So let's talk about abdominal pain. So basically, when you see the abdomen, we have the 9 regions. Okay. So basically, we need to examine where the exact cause of, where the exact location of the pain. Okay. So we have, okay, this is the diaphragm. Okay. Below the chest. Okay. This is the above the chest. We have lungs, heart, okay, and the above below the diaphragm till the pubic region, okay, till the pubic region. This is the umbilical area. Okay, we have to divide the abdomen into 9 regions. Okay, this is the division of abdomen into 9 parts. One. Sorry, here we have to draw. This is the diaphragm. This is the pubic region. Okay. These are the muscles. And we have the umbilical cord here. So we will divide into 9 segments. Okay. So this is the 1, 2, 3, 4, 5, 6, 7, 8, and 9. So these are the 9 divisions of abdomen. Okay. So this is the 9th division. So this is the right side of the body. This is the left side of the body. This is the right side of the body. R means right. L means left. Okay. So this is the right side. So we have different. So this is the 9 divisions in the abdominal area. Number 1, number 2, number 3, number 4, number 5, and number 6. So basically, you can see that this area is known as epigastric region. What this area known as epigastric region? Very important. This is the right side, na? This is the left side. First number is right hypochondric region. Hypochondric region. So this is the right hypochondric region. This is the left hypochondric region. This is the epigastric region. Okay, above. This is the right hypochondric region. And this is the umbilical region. We have umbilicus here. This is the umbilical region. And fourth side, we have lumbar region. Okay. Sixth one is, this is the right lumbar region. This is the left lumbar region. And this is the right iliac region, or we can take inguinal region, another name. Right iliac region, left iliac region, and epigastric, hypogastric region. This is the 8th number. So likewise, we are giving the names to different different areas of the abdomen. So I think you understood. So basically, where is the pain, you have to ask the patient. Okay, this is whole area is known as abdomen. So the patient will tell if the pain is here. So you have different organs here. If the pain is here, you have different organs here. If the pain is left side, you have different areas, have different organs are located. So that's the reason asking the patient, where does the pain is there? Okay, this is the best and important question you have to ask. Now come to the theory part. So basically, sometimes abdominal pain are emergencies, like in appendicitis, okay, any uh, cholecystitis, okay, like any infection in the colon, which maybe leads to cause of maybe the patient will have emergency condition. Okay, so that is the reason we want to check the abdominal pain where the pain is there. Okay, so now you have to ask the patient, okay, where does the pain is occurring you have. Okay, sometimes it may be let's see the different organs which are situated in that area. So if you see the left right hypochondric region, so we have liver, main organ. We will talk only about liver. So here we have the left, right hypochondric region. The organ is liver. In epigastric region, we have esophagus. What we have? Esophagus. In the left hypogastric region, we have stomach. Okay. Right lumbar region, we have in the below the sides of the lumbar area, we have kidney, primarily kidney, and we have the some part of liver and as well as gallbladder and some part of liver, because liver is the largest organ, so we have some part will end up here. Okay, and here we have the gallbladder and some part of large intestine, colon. Okay. So basically must magar means gallbladder is very important. Next we have umbilical area. Umbilical area have here we have the small intestine and some part of pancreas, okay, which are coming here, and some part of ending part of the stomach, okay, pyloric uh, puncture, okay, and we have the spleen. We have the spleen here, and umbilical part have small intestine, okay, duodenum, jejunum, okay, ileum, and right inguinal region have large intestine. Here also you can see in the eighth number we have the reproductive organs and some sort of large intestine and urinary bladder. Okay. In the ninth part, we have the large intestine, descending colon. Okay. You can see, or in the ladies, we have the ovaries. Okay. Uterus and ovaries. You can see those organs here. So we have to go to the part and they have to ask. First is location is very important. Okay. Location is very important and you have to touch there. How to ask the palpitation is important. Secondary means we have to go and check that area with our hand. Okay, where the pain is occurring. So palpitation, location after location we have palpitation, very important. And the third one is due to the after palpitation, if there is severe tenderness, means if you are going to touch, the patient is unable to uh, bear the touch, is stopping you from touching. So it is very severe tenderness. It means there is inflammation in that area. Okay, inflammation. If if the pain, along with the pain, if you have fever, okay, and burning micturition, burning micturition, it means that the patient have infection in urinary bladder. Urinary bladder is affected, or in the ladies mostly urethra. Okay, is this is affected. So it means that there is infection in the reproductive organs also. Okay, along with fever. If the fever is there with pain and burning micturition, you can assume that the infection is urinary bladder. Okay, and you have to check that. Okay, let's say different causes of abdominal pain in the Harrison. One second. You can see that cause of abdominal pain. You have different causes here. Bacteria or pelvic inflammatory disease, like I told you that there is inflammation in the reproductive organs, or ulcer, pancreatitis, inflammation of the pancreas, or any mechanical obstruction, okay, in the colon. It may be leads to the pain, or unable to go to the washroom, patient have constipation, severe constipation, it will also lead to abdominal pain, okay, or any obstruction in the ureter like kidney stone. These are also reason, and some conditions like a rupture of arteries, veins, and in typhoid fever also we have abdominal pain. Okay, so you can see that, and some pain will have extra abdominal, means above the abdomen, but it will understand by the only abdominal pain. Like you have heart issues, all type of heart issues, and lung issues. Okay, sometimes it will be the pain is referring from the abdominal area to upward, so you have to check all that also. Okay, other than this, and metabolic causes also have abdominal pain like diabetes, uremia, okay, hyperlipidemia, lipid level is high in the blood, and hyperparathyroidism, parathyroid glands are not working properly, and adrenal gland is also not working properly. Okay, these are the conditions, and neurological conditions also, psychiatrical conditions. I saw one patient, say, suffering from uh, first is schizophrenia and anxiety. Second is Parkinsonism. Parkinsonism is having from past 4 to 5 years. Okay. He is assuming, she is assuming that she have abdominal pain. So daily 1 to 2 times she assumed that she have abdominal pain, severe abdominal pain. So doctor gave her the lot of painkillers, and if she doesn't tolerate, she will take injections also. Okay, and sometimes we have other issues like nerve spinal cord issues also. Like some patients I saw that they have tightness in the stomach. They doesn't have proper stool. Okay, and they have constipation, difficulty in going urination. So everyone thought that hey, they have problem in the abdomen, but the problem is in spinal cord. Okay, so you have to ask the patient if you have any abdominal pain, back pain. Okay, and sometimes poisoning may be also cause abdominal pain, snake bite, spider bite, infection, insect bite. Okay, and you have sometimes heat stroke or withdrawal of drugs. These will also cause abdominal pain. So you have to ask the brief history. So in emergency conditions, we need proper diagnosis. So we have number of nowadays diagnosis centers like can do ultrasound of abdomen and pelvic. You will get the picture and structures of the internal organs. You can go through the X-ray of kidney, urinary bladder. If there any stone or any cyst, you can see with the X-ray. Or else, sometimes you have to go with CT abdomen also. Sometimes to go into the deeper picture, you will get the exact problem. Okay, so you have this is the to see the internal structures. To see the internal structure, we may uh, do the diagnosis like diagnostic tools like ultrasound. Let's see what are the things you can do. You have the ultrasound, ultrasonography, okay, and you have the X-ray and sometimes CT abdomen also needed if you are not getting the proper point. Okay, where the problem, exact problem. And sometimes endoscopy, so that due to see the ulcers, abdominal, internal structure, how the external structure is, you can see with this. But internal structure, you have to go with endoscopy, and you have colonoscopy through the colon or anus. The patient have to the patient will do the scanning and they will saw what problem is there, okay, in the internal area. So likewise, or in the a female has a cyst, PCOD issues, or other endometritis or uterine fibroid, all these issues can be seen with the help of ultrasonography. Okay, and other than that, we have blood test. Like if the patient have typhoid, you have to go through with typhoid profile, Vidal test. Okay, and you have to, if they see the inflammation, any infection in that area, you can see with the CBP. You have to check the TNC, WBC count. So likewise, you have to analyze what the problem is internally in the patient. Okay. And the what are the symptoms you can see? I told you that the pain, if along with pain, the patient will have, if have fever or chills, or you can see that fever, chills. If the fever and chills, it means infection. If the pain with weight loss, it means tumor, malabsorption, okay, or if the pain with nausea and vomiting, you can see infection, inflammatory diseases, metabolic diseases. If the pain with unable to swallow, means any gastric issues. If the pain with constipation, it means any internal issues of the colon also. If the pain with jaundice, it is the if it is in liver is affected. If the pain with diarrhea, means infection again in the colon region. If the pain with discharge, okay, it means a vaginal discharge. It means it is uh, uterus problem issues. If the pain with skin or joint disorder, it means any infection in the body, whole body. So you can see that like that. Okay. So the pain with another symptoms, we can correlate with that symptom, and you have to observe the disease. Okay. So this is the thing you have to understood. Okay. So let's talk about how to diagnose an electrohomeopathy. This is also a simple question. So basically, we have the pulse diagnosis. Okay. We'll go with pulse diagnosis. Before the pulse diagnosis, we'll ask the patient, because we have the lymphatic temperament and we have the sanguine temperament. Okay. Mostly abdomen is related to the lymphatic temperament. Please understood. So we'll talk in detail in gastro diseases. But here I am giving hint to you. So mostly abdominal pain or abdominal diseases are related to lymphatic temperament. Okay. So we need to check the temperament of the patient before treating the patient. And so whenever the patient is coming to your clinic, you are seeing his face, nose, hair, talking style. Okay. Some patient will come to you, they are only tell they have abdominal pain. And some patient will shout and they will do they will some sort of noises they will do. Some patient will come only they have they have the capacity uh to control the pain. Okay. It means the most of this type of patient belong to lymphatic temperament. Okay. But the shouting patient and unable to uh bear the pain means he's mostly is belong to sanguine temperament or nervous temperament. Okay. And you ask the patient from how many days you have pain. Okay. And where the pain is location, and you are going to palpate that area. If there is severe tenderness, okay, you have to ask the question how long you have the pain, and with that pain, another any other issues like digestion issues, nausea, fever, chills, or urinary issues, and or if female, you have to ask about mostly. Mostly female have the abdominal pain due to the issues of their organs, okay, uh, excretory organs or else reproductive organs, okay. So you have to ask the history, how the monthly is there, okay, menstrual cycle about. You have to ask compulsory that. Then you have the idea what is the reason behind the pain. And another sort of you can take the help with the help of USG, X-ray, CT abdomen. If there is more issues, you can go through the endocrine endoscopy, colonoscopy, all these issues. You will give the clear picture of the abdominal pain. So here I will explain only about the basic treatment of abdominal pain because it is a vast issue, vast problems. So we have to select the problem and we have to treat the problem. Likewise, I will give the example. If the patient is coming and he have epigastric pain, the treatment is different. If the patient is coming with liver or gastralgia, liver pain due to the fatty liver, he have the pain. The pain is different. The treatment is different. Here you have to add S3 or S5, mostly S5. But in the epigastric pain, you have to add other remedies. So basically, we will make a simple protocol for abdominal pain. So abdominal pain, so mostly severe issues are there. So we have, because abdomen is covering with the uh, we have the mucous membrane internally, okay, and because abdominal pain is not bearable because of the smooth muscle, okay, smooth muscle, all the organs in the abdominal pain is made up of smooth muscle. So there's the reason, if the little pain occurs, we cannot bear the pain due to this, and the connection between the smooth muscle and the nerves are in the large quantity. Okay. So you have start with the basic formula and the secondary according to the condition. I will give the set example. One patient is coming, we have epigastric pain. Epigastric means the area of the abdomen, the area of the esophagus and stomach, where the junction is occurs. They have pain that area, and he will tell that I have burning sensation. It means that is the inflammation also. epigastritis. Okay, so here I can treat with S10 L1WE. Okay, and second is C15 Ver1 BE or YE. Start with B because you have the burning inflammation. Then you will, after that, you have to go with YE. Because the patient have epigastric pain, I think he have abdominal issues and he stomach issues, indigestion issues. Okay, so you have to treat the indigestion also. Okay, so here you have to give the remedy of indigestion S1 WE and S10 C10 W. And if the patient have indigestion issues, if he have the constipation also, most of the indigestion due to the constipation because of the uh, proper chewing of the food. Okay, he is only swallowing the food without the chewing. So we have to advise the patient, please minimum 20 to 30 times you have to chew the food and you have to slowly swallow the food. Then only our stomach will digest the food in easy method. If you not, then the most gastric juice will release and it will damage the upper cavity of the stomach. Okay, so here the patient will have constipation also. Most of the stomach diseases have constipation issues. So you have constipation remedy SLAS. So I will advise here along with SLAS, you can advise C10 also. It we have to give in D4 and all this in this D5, D5 or D6 according to the condition. And externally, you have to apply because you have the solar plexus here, abdominal points here. So you have to apply the remedies. So mostly you have F2 WE. Okay. This is the basic application you can apply, and you can add L1 also, word 2. If the more pain is there, word 2. Okay, infective problem issues, you can add word 2 along with BE also, BE alternately YE. Okay, you can add this remedies. So these are the remedies. You can advise the patient according to the condition. So here we are making how to make the remedies. This is also very important. So slowly, gradually, we'll learn those things also. So I conclude here. So if anyone have any doubts, kindly ask.